The Mississippi Black Women's Roundtable was honored to attend as a partner in the Mississippi Repro Health Tour. Together with community allies, the Mississippi Black Women's Roundtable was able to help connect families to free reproductive health kits, trusted care resources, and life-saving information. We proudly stood alongside organizers pushing for health equity and justice for Black women and all underserved communities across Mississippi, encouraging and empowering women to become educated and well-informed about their reproductive rights, uplifting stories of resilience and organizing power, advocating against harmful federal benefit rollbacks, and supporting real conversations on reproductive rights and maternal health. We're deeply grateful for the opportunity to stand in partnership with those committed to care, access, and transformation. Join us as we continue fighting for equity, dignity, and care across Mississippi.
Hello, I'm Angel Tidwell, Program Manager of Economic Security with the Mississippi Black Women's Roundtable. So we're here again, Mississippi Black Women's Roundtable is here with several of our partners today on the Repro Tour here starting in Jackson, Mississippi, which will expand out to several cities across the state. We're here just to educate, provide resources to the community regarding reproductive health justice in Mississippi.
Hello, my name is Chastity Moncure. I'm a citizen of Jackson, Mississippi, but I'm also a line dance instructor for Dance For You. Okay, so I came out, of course, to teach line dance and like fitness and keeping mommies and Black women healthy. But also, I'm out so I can learn myself. There are some things that I don't know about the reproductive system or reproductive health, and I just want to make sure that I have the tools that I need to help myself, along with others that might come behind me.
Hi, I'm Tyler Harden. I'm the director for the Mississippi Reproductive Justice Coalition. I think the biggest decision in regards to reproductive health care or policy in general is that we matter. I think at a lot of times we lose the humanity behind the policies. We think that just because a certain type of person may need access to a service that they deserve to be treated less than human. But when we talk about Mississippians and when we talk about reproductive health care, we're talking about families. And so I want to make sure that lawmakers and policymakers know that at the root of everything, families matter and we matter too.
Hi, I'm Reverend Elizabeth Davidson. I am the Executive Director at Faith in Women. We are so excited to be here alongside so many of our colleagues and organizations that do a lot of really great direct service work. We are a faith-based organization, and our goal is to help people of faith access the resources in their own faith traditions that support their values around reproductive health, rights, and justice, and really help them to have the spiritual support that they need as they navigate decisions about reproductive health and wellness.
Hello, my name is Chelsea Dorsey. I'm the Outreach and Advocacy Coordinator with Sixth Dimension. A lot of people, when they hear reproductive health care, they automatically think about an abortion. And for some people, that's a big, scary word to say. It's a big, scary conversation to have. But reproductive health care, we're talking about a woman's right to choose whether or not she wants to have any more children, a woman's right to choose if she wants to wait to have any more children. Like myself, again, me and my husband, we decided we wanted to wait before we had any more children. And we have the freedom to do so because of what is already in place for reproductive health. But every woman doesn't always have those resources. The only difference in between me and someone else who had an unplanned pregnancy sometimes can be just, honestly, healthcare information, healthcare insurance, or their lack of information. And I choose to know what information I have access to and what tools I have access to. I think make sure that we create a narrative that's not scary and one that's non-judgmental and one that's given in love and just wanting to spread true information. I think if we can control the narrative from being scary to a positive, that would be great.
My name is Renata Chapman. I am a women's health nurse practitioner and I'm the medical director here at Get Personal by Converge. I do see a lot of patients that need access to contraceptives on a daily basis. A lot of our patients are in rural areas where they don't have access. So it definitely has a huge impact here in Mississippi. There is a lot of miseducation as it relates to contraceptives. And then also a lot of barriers to transportation, to providers and reproductive health care. Sexual and reproductive health is a huge need in Mississippi, and I think that we all should just be focused on meeting people where they are and making sure that everyone has access to whatever they choose or whatever they need.
To learn more about our work at the Mississippi Black Women's Roundtable, please visit us at msbwr.org and subscribe to our email list to stay informed.